common scenario in our clinics day-to-day activity is the fact that we meet a lot of women of reproductive age. They are unable to tell when last they have had their period. I mean the first day of their last menstrual period, which everybody knows to be last menstrual period. They are unable to give report of the date. Because of this, we are going to be discussing on the importance of taking tab and noting what is your last menstrual period. Hi, I'm Dr. Adeniro. I'm a consultant obstetrician and gynecologist, and on my video I discuss about women, their health issues, reproductive health issues, fertility, infertility, prevention of pregnancies, and think of anything that is relating to pregnancy, to women's health. That's what we discuss on this channel. And today, our topic for today is last menstrual period. The importance that are there in taking notes, taking tab of your last menstrual period. What is the last menstrual period? This is the first day of your last flow. A lot of women in the clinic, when you meet them, you ask for their last menstrual period. You are lucky. You would be very lucky if they can even tell you a date. A lot of them will not be able to say it. Most of them would rather say, or better still, give the date of the last flow, the last day of the flow. But what is very important to know is the first day of the menses. So because of this, it is important to take note of this day. There are applications that are available, downloadable on phones, and it could also be recorded on calendars in order to benefit from taking tab of it. One important thing is that if there is a missed period, everybody knows that. Could it be pregnancy? If you are not sure you have missed your period, it is very possible to have been using unprescribed medications, exposures to things that could be disastrous or be damaging to the developing embryo at this time. So you agree with me that noting the last day of your last menstrual period will be very important in order to prevent some of these complications that could arise in early pregnancy. Another importance is some people are even being worked up for infertility. They have been trying left, right, and center to get pregnant, but as God would have it, it is not yet forthcoming. Sometimes it may be better to actually target more of your sexual intercourse around your fertile period. Now, if you are not sure of your last menstrual period, would you be able to give account of the likely time that your fertile or the so-called ovulation period is likely to be? And this time can only be said to be present when you are able to give detailed and precise record of your last flow in the last 6 months. So I'm sure you will know this is very important in this group of people, and of course, in order to benefit from it, they have to document the first day of their last menstrual period. Another important thing is, even when she has gotten pregnant, the due date of their baby are best being calculated from the last menstrual period. It's only when there is no available last menstrual period, or the flow of such women are not even regular. That's when we say we go for early scan. But you have to take this. Knowing your last menstrual period can help in determining when is your baby's due date, and this can avoid complications like delivering when it's not yet time, or being anxious when there's still time for the baby to still be in utero when they can still be delivered later. Now, if you are not sure of this, you can understand all the anxiety that could arise from assuming or believing that your pregnancy has gone beyond the likely time. Another importance of knowing your last menstrual period is the fact that there are some vaginal changes, a lot of vaginal changes across the cycle of a woman. Don't forget that a cycle is from the start of one period to the start of another period. If you don't take tab, you don't note when you have your period. How would you be able to say if your period is they come on regular basis? Do you have irregular cycle or regular cycle? You will not be able to say. And for the discharge, you can only say the peri-ovulatory discharge that you are having is actually true, that of ovulation. If you are not sure of it, how would you be able to say that it is actually a peri-ovulatory sign? And of course, when abnormality is coming up, are you sure you'll be able to say that this one is abnormal, this one is normal? This will tell you that you really need to take tab of your last menstrual period. Another social importance of knowing your last menstrual period is, of course, it can make you get prepared. You don't want to have your menses when you are least prepared for it. Maybe you're on white panties outside, you don't have your sanitary towel with you, and all of a sudden there is onset of your flow. I don't want to assume the kind of embarrassment that can occur. Some vacations, you may want to plan vacations. Would you plan your vacation to the time when you are having like menstrual pain, or you are not even ready for the monthly flow? You agree with me that it is very important, both medically and socially, to determine and keep tab on your last menstrual period. Also, some conditions that are associated with irregular cycle, if you don't take tab of your last menstrual period, how would you be able to say the onset of this condition? There is uterine fibroid is there, endometriosis is there, pelvic inflammatory disease. All these can alter your cycle. If you don't have a full knowledge of how your period has always been, how would you be able to say this particular cycle is abnormal? Other things include probably a couple being worked up for infertility. The male, she has to do some tests, like most especially the seminal fluid analysis. We do it at a particular time of the cycle. If the woman is not taking tab of her cycle, when is her husband likely to do this test? She won't be able to say. And also for her, HSG, which is a commonly known test that women do for infertility cases. This particular test cannot be done at any time. It has to be at a particular time during the cycle. These two are just some of these tests that they are specific for the cycle. Other things include some medications, ovulation induction drugs. A lot of them, people use them just anyhow. And the major reason why it is like this is that a lot of them do not even know the cycle. They don't even know that it should be used at an appropriate time, at a specific time during this their menstrual cycle. When they don't know this, they take the drug anyhow. So you will agree with me that during the time of fertility workup, be it injection or some oral medications, we really need them to be taken at particular time of the cycle. You don't just take them anyhow. It's not going to make the effect, it's not going to bring about the effect we actually want them to take about to bring about. Now, these are some or few of the benefits of taking tab of your last menstrual period. A lot of people mention premenstrual syndrome. But do you know that if there is no record of your cycle and demonstrating that these symptoms that you are having are actually specific to a particular phase of your cycle, one may not be able to make the appropriate diagnosis of this medical condition. By and large, I'm sure you must have been convinced that taking tab of your first day of your last menstrual period goes in a long way in like avoiding some minor health issues which actually at the end of the day may become complicated. So henceforth, what I want you to do now is that ensure you have some applications on your phone, 1 or 2 applications to take tab of your last menstrual period. It will avoid unnecessary stress on you, and it will give you the benefit of recollecting properly. Calendar method can also be used whereby you indicate the time of your period on the calendar. Once again, I'm Dr. Adeniran, consultant obstetrician and gynecologist. On my channel, I discuss issues relating to women, especially reproductive issues relating to women. And what I want from you actually is that you continue to follow, you watch, subscribe, always watch and subscribe. Subscribe to my channel, watch our videos, and always share in order for people to learn more from my wealth of knowledge.